For over 75 years, Olmsted Medical Center has been the provider of personalized, quality patient care in southeastern Minnesota, providing easy access to healthcare options that meet the needs of individuals and their families. We bring simplicity and compassion to the complexity of healthcare. With over 1,400 healthcare professionals across 35 specialties and 22 locations, Olmsted Medical Center continues to grow and serve new communities with patient-centered, community-focused, future-oriented care.
Olmsted Medical Center being around for 75 years as an independent organization, which is really challenging for a lot of healthcare organizations to be able to aspire to. We've done it with, I'd like to consider some of the most basic elements, which is patient-focused, community-based, and future-oriented. Those are some of the things that we aspire to achieve. Olmsted Medical Center has been judicious in sticking to the healthcare needs that we think we can provide, not just in an episodic manner, but in a full continuum of care. With the patient at the beginning, looking at where we should be from physical locations, the type of care the patient needs, but knowing that we can do it in a sustainable and professional manner with excellent outcomes for the patient.
3 core values at Olmsted Medical Center. Our number 1 core value is patients are our highest priority. The second one is our people are the key to our success. And the last one is our communities are the source of inspiration. The difference between population health and community health, I would say, is more population health refers to those populations of patients with particular medical problems or conditions. Diabetes, asthma, high blood pressure, etc. Community health is more the broader term. It's the term of everyone that's in that community and as a whole, and how can we better care for them. Sometimes we provide care that's outside of a clinic visit and also impacts community health. So for example, if you can't mow your lawn, we can plug you in with some local group that can help you do that. If you can't get to an appointment and transportation's an issue, hey, we can help you with that as well.
Here in Olmsted Medical Center, we mold the patient healthcare plan or the individual's healthcare plan based on their individual risk factors, their medical background, their demographics, their social habits, their family genetics. So no one size fits all. We do our best to provide and deliver a personalized healthcare that fits who that individual is, regardless of their medical, social background. We're very unique in our approach to healthcare because we treat the patient where they are in their journey in their healthcare.
My healthcare organization has a focus on cultural competency. Systems are really slow to change. However, the Patient Advisory Council recognizes that those differences matter, that there's not a hierarchy of human differences, and is moving towards cultural competency outcomes of optimal healthcare by making incremental changes through DEI initiatives, education, addressing inequities, and attempting to correct mistakes. From the questions that they ask, the racial categories have been expanded over the years. The way that I think dictation has been huge, so the doctor can spend more time with me and my notes are accurate in my record, sharing of records in short order and having ways to correct things if necessary. Technology has done some really wonderful things in the efficiency of that communication. Translations also happen quicker because of technology, and I think that is moving at lightning speeds.
20 years ago this fall, I found myself in the emergency room at Olmsted Medical Center here in Rochester with a ruptured appendix. I was extremely thankful that there was care available promptly. Following that surgery, there was beautiful care in the hospital itself. I have found the staff to be particularly professional, welcoming, and it has made it a very comfortable experience for myself and my family over these years that we've been here in Rochester. Having had care provided to myself, my family, my mother, our granddaughter, it's professional, it's caring. If you can believe healthcare can be a pleasant experience, that has been very much my experience over these years here. But this is a beautiful place to live, and we're very fortunate to have Olmsted Medical Center here.
Inspired by our commitment to community, Olmsted Medical Center is dedicated to delivering exceptional, patient-centered care in southeastern Minnesota. Join us in celebrating over 75 years of better health and better lives. Good health starts with great care. at Olmsted Medical Center.